Welcome to our safety meeting from Medasend Biomedical. This is our precautions for healthcare workers. Okay. Doctors and medical personnel safety, we're going to be reviewing this today so you're safer in your workplace. Doctors and healthcare workers are exposed to the dangers of getting infected or injured almost every day while at work. Sometimes a healthcare worker is just too busy to remember that he should keep himself safe and the importance of safety protocols. Okay. A long list of diseases transmitted to and from healthcare workers. They are in contact with patients' skin, wounds, secretions, and other fluids that contain other potentially infectious material, OPIM. Blood-borne pathogens are considered the most dangerous threat to healthcare workers. So here are some precautions for healthcare workers. Of course, you're treating every patient as though they may already be infected. Typically, you'd wear gloves whenever you're examining a patient in case of direct contact when touching a patient. Use separate gloves for each patient, washing your hands before and after you put on gloves. Make sure to wear an apron or gown during surgery, as well as the mask, gloves, etc. Any waste product, used materials, specifically those containing blood or patient's fluids, should be put in medical waste and or sharps containers immediately after use. Take all vaccines and flu shots for healthcare workers. Here's another tip in avoiding a needle stick injury. A needle stick injury is a major risk for any doctor or healthcare worker and can cause many different types of transmitted diseases, including hepatitis B, C, or HIV. Here are some safety tips to avoid needle stick injuries. Follow these tips to be safe. Never recap needles. Recapping a needle puts you at risk of injury to yourself and getting infected. Always wear gloves if there's contact with blood or other OPIM if it's anticipated. Never use a needle for more than one person. All needles and sharp instruments should be disposed of, discarded in a puncture-resistant, puncture-proof container and not be mixed with other wastes that are put in bags or non-puncture-resistant boxes. These should be disposed of daily.